The patient will come into the hospital usually a couple hours before the surgery time. And depending on specifically what she's having done, she may have to have a couple of procedures done prior to the actual surgery. A lot of times the mass cannot be felt on exam, and so the patient will have a device placed within the hour or so before surgery to make it possible to find the tumor in the operating room. The most common way of doing this is something called a wire localization, where the radiologist will do a mammogram or an ultrasound prior to surgery, and they'll numb the area up and put a thin little wire down to mark that spot. And that wire is what will lead the surgeon to the right area to have removed. So that procedure is generally done about an hour before surgery. If the patient needs to have lymph nodes removed as well and is having a sentinel node biopsy, then they will also have an injection of a tiny drop of fluid that has a small amount of trace radioactivity in it, and that helps the surgeon find the lymph nodes that are draining from the breast. So that would also be done about an hour or so before surgery. The surgery for lumpectomy is generally done under either a very deep sedation or general anesthetic, which means the patient really will not be aware of the surgery when it's going on. The surgery itself can take an hour and a half in most cases for a lumpectomy, and then the patient will go to the recovery room. Once they have woken up enough from the anesthesia, an hour or two later, depending on the anesthesia and the patient, they'll be able to go home that day.